The room is dark, the house is quiet, and you are finally asleep. Then, sometime after midnight, your eyes open and you realize you need to use the bathroom. You get out of bed, move slowly through the darkness, and try not to disturb anyone. Maybe it happens once, maybe twice, sometimes 3 or 4 times in the same night. After a while, you stop questioning it because you've heard the same explanations so many times. You're getting older, so this must be normal. But there is another question that deserves just as much attention when it comes to aging and medical care. Can looking for a problem sometimes create a chain of tests, procedures, anxiety, and complications that leaves a person with more problems than they started with? That doesn't mean medical testing is bad. Far from it. The right test at the right time can detect disease early and save a life. The concern is what happens when testing is performed without a clear medical purpose, especially when an unexpected finding sends an otherwise healthy person down a long path of investigations. This becomes increasingly important after the age of 60 because medicine has become extraordinarily powerful at finding abnormalities. Modern imaging can reveal details that doctors decades ago could never have seen. Blood tests can identify tiny changes before a person notices any symptoms. Screening programs can detect certain cancers and other diseases at stages when treatment may be more effective. On the surface, more detection sounds like better medicine, but detection is only the first step. Once an abnormality appears on a report, someone has to decide what it means. Is it dangerous? Is it harmless? Has it always been there? Will it ever cause a problem? And what should be done next? Those questions can lead to additional scans, specialist appointments, biopsies, procedures, and repeated follow-ups. Sometimes those steps are necessary and genuinely beneficial. Other times, the original finding may never have caused harm at all. Imagine walking into a clinic feeling completely healthy. You are independent, you are active, and you are still doing the things that make your life enjoyable. You have no major symptom demanding investigation. Then a test is suggested simply as a precaution. You agree because the idea of checking seems sensible. A few days later, the report comes back with an unexpected abnormality. Perhaps it mentions a small nodule, a shadow, a cyst, a lesion, or a blood value that falls outside the expected range. You may be told that it is probably nothing serious, but because nobody can be completely certain from that first result, another test is recommended. Then another appointment. Perhaps a specialist becomes involved. Maybe the next step is a biopsy or an invasive procedure. Every person involved may be acting with good intentions, yet the process can gradually become much larger than the original concern. Clinicians sometimes call this a diagnostic cascade. One uncertain finding creates another medical decision, which produces another finding, which creates another decision. The uncomfortable reality is that more information isn't automatically better information. Medical information becomes useful when it helps a doctor and patient make a meaningful decision. If the test result is unlikely to change what happens next, the value of performing that test may be limited. And if an abnormal result is likely to trigger a series of investigations without a clear endpoint, the potential downsides deserve to be considered before the first test is even ordered. This is not an argument for avoiding doctors, refusing appropriate screening, or ignoring symptoms. It is an argument for understanding why a test is being performed in the first place. Before agreeing to any non-urgent test, it can be reasonable to ask what the doctor is looking for, how likely the test is to find something important, what would happen if the result were abnormal, and whether the result would actually change the treatment plan. Whole body imaging is one example of why that distinction matters. The concept is extremely appealing. Instead of waiting for a symptom, why not scan the entire body and search for hidden disease before it has a chance to cause trouble? A full-body CT or MRI can sound like the ultimate health check, almost as if modern technology could provide a complete report card on every organ. For someone who wants certainty, the idea is understandably attractive. But the human body isn't designed to look perfectly normal on a highly sensitive scan, particularly after decades of life. Small cysts, benign growths, old scars, anatomical variations, and other incidental findings become increasingly common with age. A sophisticated scanner may detect all kinds of details that have absolutely nothing to do with a person's health. Now imagine that such a scan identifies a tiny spot in the lung. The spot may be harmless. It may have been there for years. It may never develop into cancer. But because the scan has identified it, the medical team may need to determine what it represents. Perhaps another scan is recommended after several months. When that scan is performed, doctors may compare the images and ask whether the spot has changed. If there appears to be a difference, another question follows. Is the change real, or could it simply be a difference in how the images were taken? Does a specialist need to review it? Is another imaging study necessary? Suddenly, the person who walked into the clinic thinking they were healthy is waiting for another appointment and wondering whether something is growing inside their chest. The finding may eventually turn out to be completely harmless, but the uncertainty itself can become a significant burden. Similar situations can occur when imaging reveals unexpected findings in the kidneys, liver, thyroid, or other parts of the body. Some discoveries are clinically important and need treatment. Others are incidental findings that would never have caused symptoms or shortened a person's life. The difficulty is that the initial image may not provide enough information to immediately tell the difference. Further testing may be required, and every additional step brings its own considerations. Sometimes the cost is simply money and time. Sometimes it is anxiety and repeated medical appointments. Repeated imaging can involve additional radiation exposure when CT scans are used. And if the investigation eventually leads to an invasive procedure, there can be risks such as bleeding, infection, or other complications. This is why impressive technology should never be the only reason to perform a test. The more useful question is, what decision the test will help make? The same principle becomes important when people become worried about memory. Forgetting someone's name for a moment, walking into a room and suddenly forgetting why you went there, or struggling to find a familiar word can be frustrating, particularly when these moments seem to happen more often with age. They can also be frightening. A person may immediately wonder whether they are developing dementia or Alzheimer's disease, and family members may become concerned as well. Someone might suggest getting a brain scan just to make sure nothing is wrong, but an image of the brain is not the same thing as a test of how the brain is functioning. An MRI can show structural changes, but many of those changes become more common as people age. A report may mention differences involving brain volume, white matter, or small blood vessels, and those terms can sound frightening when a person reads them without the clinical context needed to understand what they actually mean. That is why memory evaluation should begin with the person rather than the picture. A clinician may want to understand whether the individual can still manage finances, prepare meals, organize medications, navigate familiar locations, follow conversations, and handle the responsibilities that have been part of everyday life for years. Brief cognitive assessments can also provide useful information about memory, attention, language, and problem solving. If there is evidence of genuine cognitive decline, the next step is to investigate possible causes rather than assuming that a brain image alone provides the answer. Medication effects can sometimes contribute to confusion or forgetfulness. Poor sleep can interfere with concentration and memory. Mood disorders can affect attention. Certain nutritional deficiencies and other medical conditions can also contribute to cognitive symptoms. In other words, a useful evaluation often looks at the entire person instead of searching for a single abnormal image. The heart presents another example. Many people reach their 70s and assume that a treadmill stress test should automatically become part of their routine. The reasoning sounds sensible. Heart disease becomes more common with age, so why not place the heart under stress and see whether anything happens? But a stress test isn't simply a routine inspection based on someone's birthday. Its usefulness depends on symptoms, risk factors, medical history, medications, and the specific question the doctor is trying to answer. Consider an older adult who regularly walks several miles, climbs stairs, works in the garden, and handles daily activities without chest discomfort or unusual shortness of breath. That person's clinical situation is very different from someone who develops new pressure in the chest whenever they exert themselves. The presence or absence of symptoms can completely change the reason for testing. When a heart test produces an uncertain or abnormal result, another cascade can begin. An abnormal stress test may lead to additional cardiac imaging or specialist evaluation. In certain situations, an invasive procedure such as cardiac catheterization may be appropriate because the information could directly affect treatment. But an invasive test isn't something that should be performed casually simply because technology makes it possible. The central question is whether the information obtained will change management in a way that benefits the patient. This is also why risk assessment and diagnostic testing should not be confused. Some tools estimate a person's future cardiovascular risk, while others investigate symptoms or suspected disease. A person with new exertional chest pressure, unexplained shortness of breath, fainting, or a significant decline in exercise ability deserves medical attention because those symptoms provide a specific reason to investigate. The goal isn't to ignore the heart, it is to match the test to the clinical situation. Colorectal cancer screening provides another example of how the balance between benefit and risk can change with age. Colonoscopy can be extremely valuable because it can detect colorectal cancer and identify certain precancerous polyps that can sometimes be removed before they become cancerous. But screening is intended for people who do not currently have symptoms, and the potential benefit of finding a disease early has to be balanced against the person's overall health and expected benefit from treatment. As people become older or develop significant medical conditions, the risks and burdens associated with preparation, sedation, dehydration, and the procedure itself may become more important. That doesn't mean age alone should determine whether screening continues. A healthy older adult with a strong family history or a history of high-risk polyps may have very different needs from an older adult with serious medical problems and repeatedly normal previous screenings. The right decision depends on the individual. There is an equally important distinction between routine screening and investigating symptoms. If an older adult develops blood in the stool, persistent changes in bowel habits, unexplained weight loss, ongoing abdominal symptoms, or unexplained anemia, the situation is no longer simply about whether routine screening is appropriate. There is now a specific problem that needs an explanation. A doctor may recommend diagnostic testing because the symptoms themselves have changed the level of concern. This distinction is important across medicine. Getting older does not mean ignoring warning signs. It means becoming more thoughtful about why a particular test is being recommended and what question it is intended to answer. There is also a psychological side to medical testing that doesn't always appear on a medical bill. Once a person hears the word abnormal, it can be difficult to return to the way they felt before the test. Someone who considered themselves healthy may suddenly start thinking of themselves as a patient with a disease. Even when a finding is probably harmless, waiting for a follow-up scan can create weeks or months of anxiety. Family members may become worried. The person may begin searching the internet for explanations and become frightened by possibilities that are unlikely to apply to them. Every minor ache can suddenly feel significant. A test that was ordered to provide reassurance can sometimes create the opposite experience. Again, that doesn't mean testing is bad. It means testing is powerful, and powerful tools need to be used with a clear understanding of both their benefits and their possible consequences. This becomes particularly important because modern medicine is exceptionally good at detecting abnormalities. But not every abnormality represents a disease that needs to be treated. The more sensitive the technology becomes, the more likely it is to find small variations that previous generations of doctors never knew existed. Some of those discoveries will save lives. Others will never cause harm. The challenge is distinguishing between the two without exposing the patient to unnecessary procedures simply because the first abnormal result creates pressure to do something. Sometimes observation is appropriate. Sometimes a repeat test is appropriate. Sometimes specialist evaluation is necessary. And sometimes the best decision is to leave a harmless finding alone. The answer depends on the person, the finding, and what could realistically be gained from further investigation. This is why health after 60 shouldn't be reduced to the number of diagnoses appearing in a medical chart. A person can have several chronic conditions and still be active, independent, socially connected, and satisfied with life. Another person may have relatively few formal diagnoses, but struggle with mobility, sleep, memory, hearing, nutrition, or the ability to perform everyday tasks. Medical numbers matter, imaging matters, laboratory results matter, but they are only pieces of a much larger picture. What also matters is whether a person can get out of a chair, walk safely, climb stairs, carry groceries, prepare meals, manage medications, maintain relationships, and continue doing the activities that give their life meaning. Those abilities may never appear as a dramatic image on a radiology screen, yet they tell us something essential about health, how well a person is actually functioning. A scan can contain an imperfect finding while the person remains active and independent. At the same time, a scan can look reassuring while the individual is struggling with fatigue, balance, cognition, or daily activities. Aging naturally brings changes to the body, and the medical challenge is not to eliminate every imperfection. The challenge is to recognize which changes matter and which ones don't. Context is what makes that possible. A small abnormality in a healthy older adult may lead to a different decision from the same abnormality in a much older person with several serious medical conditions. Occasional forgetfulness in someone who remains fully independent is different from rapidly progressive confusion that begins interfering with safety. A stress test for someone with exertional chest discomfort is different from the same test performed solely because the person has reached a certain age. Colorectal screening in a healthy older adult is different from investigating new blood in the stool. Good medicine doesn't simply ask what test comes next. It asks what this particular person needs and what outcome the test is expected to improve. That is why patients can reasonably ask questions before agreeing to a non-urgent test. You can ask, what are we looking for? You can ask, if the result is positive, what would we do differently? You can ask, what happens if the result is unclear? You can ask, are there alternatives? You can ask, what are the risks of the test itself? And perhaps the most useful question is, how will this information change my care? These questions are not confrontational, and they don't mean you distrust your doctor. They simply make the medical decision more transparent. A good healthcare conversation isn't about automatically saying yes or no. It's about understanding the reasoning well enough to make a decision together. The same thinking can be applied to prevention more broadly. Preventive healthcare does not mean searching for every possible abnormality inside the body. Prevention can involve controlling blood pressure, staying physically active, avoiding tobacco, maintaining a nutritious diet, keeping vaccinations up to date, receiving appropriate cancer screening, reviewing medications, addressing vision and hearing problems, protecting muscle strength and balance, and treating sleep disorders. These actions have an important difference from indiscriminate testing. They can improve the conditions that support health without first requiring the discovery of a hidden abnormality. Sometimes testing and prevention work together, but more testing is not a replacement for healthy behavior. Medication reviews become especially important as people grow older because prescriptions can accumulate over many years. A medication that made sense at one stage of life may later need to be reconsidered because another medicine has been added, health circumstances have changed, or side effects have appeared. This does not mean stopping a prescription on your own. It means asking a qualified healthcare professional to review the complete medication list periodically and confirm that each medicine still has a clear purpose. The same principle applies to supplements and other preventive products. More isn't automatically better, and adding something simply because it might provide another layer of protection can sometimes create unnecessary complexity. Perhaps the most important point is that deciding not to perform a particular test immediately does not always mean refusing medical care. Sometimes the appropriate plan is to monitor a finding. Sometimes a test should be repeated after an appropriate interval. Sometimes another test provides better information. Sometimes new symptoms make evaluation necessary. And sometimes, after considering the person's age, overall health, expected benefit, possible risks, and personal priorities, the doctor and patient decide that additional testing is unlikely to improve the person's outcome. That isn't necessarily neglect. In some situations, it can represent careful medical judgment. The important thing is that the decision should be intentional rather than automatic. So the next time someone recommends a medical test, don't respond from fear, and don't respond from fear in the opposite direction either. Don't assume that every test is dangerous, but don't assume that every test is beneficial simply because it exists. Ask what the test is designed to discover. Ask how likely it is to find something important. Ask what happens if the result is abnormal. Ask whether the result will change treatment. Ask what the potential downsides are. Then discuss those answers with your healthcare professional and consider how the decision fits into your own health goals. Because the ultimate purpose of medical care is not to produce the largest possible collection of test results. It is to help a person live as well and as long as possible while avoiding preventable harm. For someone in their 60s, 70s, or 80s, that may mean continuing to walk independently, staying strong enough to travel, playing with grandchildren, maintaining relationships, managing everyday responsibilities, and remaining capable of making choices about how to spend each day. Those outcomes may not look dramatic on a medical report, but they are often the things people most want to protect. Aging should not become a race to discover every imperfection hidden inside the body. It should be a process of making smarter decisions about what deserves attention, what deserves monitoring, and what may not deserve intervention at all. Appropriate screening can save lives. Early diagnosis can make treatment possible. Symptoms should be taken seriously. Regular medical care matters. But none of that requires saying yes to every possible test. The goal is not maximum testing. The goal is appropriate care. And that brings us back to the question that started this discussion. If a test finds something, what happens next? If the answer is clear and the expected benefit is meaningful, the test may be exactly the right decision. If the answer is uncertain, that uncertainty deserves to be discussed before the test begins. Sometimes the smartest medical choice isn't to search harder. Sometimes it is to understand the person, understand the risk, understand the possible consequences, and then decide whether searching further is actually worth it. So if you wake up tonight and make another trip to the bathroom, don't automatically assume that every change in your body is simply something you must accept because you're getting older. Pay attention to patterns. Mention persistent concerns to your doctor. And when a medical test is suggested, remember that you are allowed to understand why it is being recommended. You can ask what problem it is meant to solve. What could happen after an abnormal result? What risks come with the test? And whether the information is likely to change your care. Those questions don't make you a difficult patient. They make you an informed one. More information can sometimes save a life, but more information can also create uncertainty when it isn't connected to a clear medical decision. The difference lies in how the information is used. A scan can reveal something important. A blood test can uncover a treatable problem. A screening test can detect cancer early, but an incidental finding can also send a healthy person into months of follow-up, repeated imaging, invasive procedures, and anxiety for a condition that may never have affected them. Good medicine is not about avoiding every risk. It is about understanding which risks are worth taking for the benefit they can provide. After 60, that balance becomes even more personal. Your age matters, but so do your symptoms, your existing conditions, your previous test results, your medications, your functional ability, your life expectancy, and the things you personally value most. There's no single testing schedule that perfectly fits every older adult. The right approach is the one that makes sense for the individual sitting in front of the clinician. So keep the appointments, follow appropriate preventive care, investigate symptoms that deserve attention, take prescribed medications as directed, ask questions when a test is recommended, and don't confuse being proactive about your health with being tested for everything modern medicine can detect. Because a normal scan is not the definition of a healthy life. A laboratory report cannot measure every meaningful part of your well-being. Health is also the ability to move, think, connect, participate, decide, and remain independent. Medical testing should support those abilities, not accidentally take them away through unnecessary interventions. The next time you hear the words, "We should run a test just to be safe," don't panic and don't automatically agree. Ask one simple question first. What are we hoping this test will change? The answer may make the decision obvious. It may reveal that the test is important. It may lead to a different test. It may lead to monitoring instead. Or it may show that testing right now offers little benefit. That question doesn't reject modern medicine. It uses modern medicine more intelligently. And sometimes, especially as we get older, protecting your health isn't about finding every possible problem. It's about knowing which problems truly need to be found.